I don't want to let this broadcast pass without coming back to something that you used, a phrase you used, which I really like, which is clinical inertia. Clinical inertia remains a problem, and it leads to unnecessary and damaging hyperglycemia that can persist for years in some patients. Failing to intensify therapy as needed contributes to costly complications, more hospitalizations, increased resource use. Medications represent only 28% of diabetes-related costs. I mean, that's a number that was surprising to me, but in retrospect, it shouldn't be. Substantial evidence suggests that a multi-agent approach improves glycemic control, and better glycemic control leads to reduced overall cost despite potentially higher drug acquisition costs. So further, good evidence suggests that concomitant obesity and type 2 diabetes contributes to much higher patient costs. The cost of interventions can be modest compared with the benefits to patients and the prevention of complications, and may in fact represent money well spent. Within healthcare organizations, goals include optimizing resource management, improving clinical management through optimal care, strategies to improve adherence, ensuring appropriate use of medications as outlined in national guidelines and national recommendations. Many strategies have been proposed to improve patient care, including methods to incentivize, there's a word I don't like, incentivize, I haven't got a better one, by the way, but incentivize healthy behaviors, provider-focused initiatives that link payments to patient outcomes, money talks, accountable care organizations or ACOs, and consumer-directed health plans. And it seems no one of these approaches is perfect. For example, ACOs provide moderate cost savings on the clinical side, but they don't adequately reduce administration and coordination costs. Consumer-directed plans may lead to an unintended reduction in the use of preventive care as consumers themselves try to save money. Now, several studies have shown that a comprehensive disease management, multidisciplinary team approach improves cardiovascular glycemic outcomes, which reduces complications and associated morbidity and associated cost. That being said, what steps has your organization panel, your organization taken to incentivize healthy behaviors, to promote prevention and reduce complications? Reducing copays, for example, for type 2 diabetes or obesity medications. I'm going to put Jeffrey on the hot seat. You said that didn't work very well.
I have not seen good data showing that that reducing or limiting copays actually changes behavior
Really?
or improves outcomes. So, yeah.
I was going to say some of the things that we've done, in my group is we've hired RN navigators. So what these RN navigators do is they're involved in transitions of care. So somebody who's coming home from the hospital, gets contacted on the day of discharge, gets their follow-up appointment set, because that's a high-cost, issue in the United States healthcare system. We have disease management programs. Actually, the doctors are incentivized now. Great term that you love.
You got a better one? I'm desperate for a better term.
By having quality scorecards. So a couple of the metrics that we're being scored on include diabetes metrics as well as hypertension metrics. So we do have a program with Silver Sneakers where people that with certain diagnoses or people above 60, have access to a gym.
Silver sneakers.
Silver Sneakers.
You want to take one moment and give me the etymology of silver sneakers?
I have no idea where that came from, but maybe gray hair.
I'm guessing, yes, silver means aged, and sneakers maybe exercise? I don't know.
Yeah, so
That's exactly
probably.
what it means.
Is that right? I knew I'd have an answer somewhere.